Greetings, it's Dr. Appel here from New Jersey Foot and Ankle Center. It was great to see you guys at the conference. I just want to go over how to fit your orthotics into your shoes. There are two different kinds of orthotics that we might have ordered for you based on your needs and the type of shoe gear that you wear. This is a sulcus length orthotic. This one goes right underneath the ball of your foot. So it's not a full length orthotic like we see here. The full length orthotic might need some trimming to fit into the shoes that you're going to be wearing. The sulcus length is made that way so that it can fit into a flat or a tighter shoe. With your pair of orthotics, you are going to be supplied an information sheet. This information sheet will tell you how, in written form, to fit your orthotic device into the shoe and trim it properly if need be. You'll also get an instruction on how to break in your orthotic device as well, which we'll go over a little bit later in the program. If you plan on using any shoe that needs to be cut down to size, often we recommend that you take out the insole that comes with the shoe. You'll place that out to the side. This is going to be used later on to trace the full length orthotic to fit properly, because there might be some gapping that you might see if you line up the heel to the front of the foot. So if there's some gapping, you might have to cut it down to size. And you'll do that by tracing it, which we'll go over later in the program. Here you can see that there's a insert that we're putting over the orthotic device. Here we're tracing the end of the orthotic device where it would fit. Usually you would want to have the insole all the way back to the heel. So you can see the green insole there. You want to push that all the way back to the heel and actually trace out the remaining area. So there's that trace line. Next, you're going to take a scissor and you're just going to cut along that trace line. We want to make sure it's nice and round, there's no jagged edges. It's nice and smooth now. Once again, hold it up to the old insole that came from the shoe. Make sure that it fits properly with the heel all the way back to the heel cup. Now we're going to fit it into the shoe. It's important at this point that you loosen up the laces because it's going to fill up a little more room in that shoe. You want to make sure it's not too tight when you relace it. Put your hand into the shoe, make sure that it's fitting properly. There's no bending of the orthotic. Breaking in the orthotic. When we recommend for our patients to break in the orthotic, normally you have to do that sequentially over a few days, normally 5. The first day we recommend 1 to 2 hours of wear, and you increase that by 1 or 2 hours every day of those 5-day period. So for instance, the second day you would wear it for 2 to 4 hours. And recommendations are that you wear the orthotic at home so that if it does become bothersome, it's not going to affect your workday. With the new orthotics, you might experience a little bit of soreness in the knees, in the foot and ankle, or the hips and back. That's because the orthotics are meant to realign your foot and ankle and the rest of your body, which goes up the chain. If you experience that, slowly back down on the break-in period to allow for a longer period of time, which might take more than 5 to 10 days. In that period of time, I always akin it to an Olympic sprinter being thrown into a swimming pool. There's going to be new muscles that are being used, and ligaments are going to be stretched in different directions. Also, the knees might be realigned to be articulating in more proper position, which might also cause some more pain in the knees and the hips. This is Dr. Appel, coming to you from New Jersey Foot and Ankle Centers. You know, like we say here, you always have a podiatrist in the family.